Good afternoon. Thank you for coming back in the room. We are now starting with a short panel discussion. And then there are lots of questions in the chat. So we'll bring you in. I'm just waiting for Fernanda to become visible on the screen in the room, which we haven't achieved yet. Is she?
Oh, yeah, she
is.
Good.
I can't see this. The screen is put in such a way that I actually can't see it. Okay, right. Everything is perfect. Can you get a bit, adapt the camera so that Fernanda is also visible? And I don't know what is going to be recorded now. Oh, well, find out. Now maybe I can pin this rather. How about this? Yeah, maybe. Thank you for coming. We had 4 talks, quite different talks today, on humanities perspectives and social science perspectives on the psychedelic medicalization largely. That clearly was the focus. I wondered to which degree questions that sort of came up a little bit yesterday and that were again sort of put in the center in different ways in today's talks, this question of the uses, the transparent, obvious, intended uses that people say they want, the uses that actually might be intended less visible indirectly, as Nicholas pointed out, or as you also, Franklin, alluded to. So what is the relationship? Maybe we can start with this question of the ways in which psychedelics can be used and what we conceptualize them as, and this tension between the substances on the one hand and the experiences on the other. Would one of you maybe want to say something on this to start a discussion? Thank you.
Yeah, I'm happy to start off. I think that's a really interesting question and triggers thoughts in me that are really to step back from kind of the biomedical and particularly the psychiatry side, getting at questions, again, that are not unique to psychedelics, which is really what is the aim of psychiatry? Is it to treat defined entities that we call mental illness, or is it to engage with people who experience suffering of a more nonspecific nature and to help them experience improvement in their lives? And I think that's a tension that is playing out within psychedelics because people often feel better in some way, but they, as I was speaking to in my talk, I think that there may be some risk in using them as treatments for mental illness rather than as offering them as things that people can benefit from and as a side effect, essentially experience benefit in terms of things like depression and anxiety. So I think this kind of connects with what the role of psychiatry is and whether or not we are supposed to be invested in wellness enhancement versus reduction in symptoms. And that's a really deep and important question. And I will somewhat provocatively just note, because I can't help myself, that Nick, you implicitly quoted Thomas Szasz when you mentioned Problems of Living earlier, the famous anti-psychiatrist of the 1960s and 70s.
And
was that intentional when you said Problems of Living? So for those that are not familiar with Szasz's work, Thomas Szasz was the founder or father of anti-psychiatry, and he essentially said that all mental illness was a fiction, and it really was just problems of living. Very controversial figure, very wise figure, and a psychiatrist himself.
It's not one to build a reference.
You need to speak directly in the microphone.
Yeah, I did not want to turn this into a reference to Thomas Szasz. And I agree that Thomas Szasz is a highly problematic figure in many ways, so I did not want to align myself with him.
But yeah, I think this issue of the ways of living, right, that need to change to really affect healing of mental states or whatever states that are actually suffering. Yeah, so I totally agree that we need to reconsider psychiatry and to collaborate. And I think that actually also from a social scientific humanities perspective, considering again our context here, we should also take the psychedelic revival as this really the chance to question psychiatry and to reform it. And perhaps that's not gonna happen within the medicalized vision that we are still living in most of the time in the psychedelic revival. So tying back with these with the anti-psychiatry movement and moving psychiatry into other areas, other contexts. So maybe taking psychiatrists like you, Franklin, who are open towards other perspectives out of your regular environment and experimenting with people like you. And seeing what can come out of if we take the psychiatrists into a different context and try to create different ways of living that can then in an intertransdisciplinary way produce other forms of knowing about this living as well, is what is needed now. And so I think we really need to leave these institutions, these houses, create new settings, new places and living forms where we can then create a new culture and go really back to really reconstruct society from the ground up as something more amenable to human and non-human broader flourishing of our world. And for me, I'm always also speaking from my personal experience, as you noticed. For me, like changing not just relations and therapeutic contexts, but especially changing my living situation, my housing situation was so essential for my mental health and my healing. So I moved out of an apartment situation with living with one person, and now I live in a new house, a co-living house, a collaborative living house with 100 people. And we create different relational structures there, different governance systems, bringing in our own food from farmers, supporting each other, gardening, what have you, different creative practices. There's space for everything. And this is for me, this recreating of a better world, a living world in such spaces. And what is the real vision, I think, that we need as a society, as a culture? Sorry, I was speaking for long now, but
thank you for sharing all this, Claudia, about your changes in your life. I would like to ask now actually Fernanda, because she spoke and she finished her talk with this way in which different cultures and practices of living, we need a different kind of exchange that is not so much dominated by the Western discourse, but actually has a very different engagement and appreciation of, for example, that very different indigenous contexts within which she has been working. So maybe when we talk about living differently and the roles that psychedelics as maybe forms of indigenous sources of knowledge or engagement with the world on the one hand, and then as something that is or isn't a drug and can provide specific weird experiences in the global north, how such a different way of cultural exchange could look. And there's also a just, Fernanda, a second question from the chat I want to pass to you as well right now, which is about the role of NGOs and the challenges or opportunities they face in the co-creation of knowledge regarding psychedelic medicines and their integration. So especially because you work in an NGO, I think this would be a very important additional question in terms of the role that certain organizations can play in this vision that you proposed.
Yeah, thank you. So yeah, in terms of the first question, I think we are in a very opportune moment in terms of all these movements towards psychedelics and indigenous medicines and so on, because to me, it sort of like begs us to question a lot of things, you know, not just how knowledge is produced, but as I said, science, and but also what is medicine, specifically in this medical context. Because when I think about like some conceptions of medicines to indigenous groups, there are groups from the First Nations, for example, that they see medicine as everything that comes from the earth, and they use like these words called mashikiki to define it. And it's like anything can be medicine, including us, you know, can be medicine to each other. So again, the like, it's not just about the substance, but I think it's how we are living and experiencing these relations, in relation to each other and in relation to other beings, and how we can help each other and we can collaborate to heal each other in different ways, as Claudia was saying, you know, from her experience in terms of gardening, in terms of community, in terms of singing together, breathing together. You know, there are many examples in which we can heal ourselves that go beyond the psychedelic context and the substances and so on. And I think indigenous community teaches a lot about it, because one of the essential points of their medicinal uses is the community. Is that's why they don't need like the integration, because they are already sort of like integrated, and they share these ontologies and they share these beliefs and so on. So it's not hard to integrate their experiences with these medicines. It becomes part of their life, part of their identity of who they are, and so on. And I think there is this difference about the acquisition of knowledge as well. You know, they acquire knowledge by experiencing things. And many times we acquire knowledge in a more like conceptual way, you know. So I will always remember when we were having this meeting with Filament Health, that it's proposing to develop the ayahuasca pill. And they were presenting everything about the pill, you know, like it took them, I don't know, like almost like 1 hour to present. And then we opened for questions. And the first question that came from an indigenous leader was that, have any of you tried ayahuasca? And the answer coming from all of them was no. So to her was just like, how come are you producing a pill and you haven't experienced like the effects of the medicine that you were actually producing, you know? So there is this really gap between the way how we deal with knowledge and how we acquire knowledge to the way that they do it. And the other question about the NGOs, the challenges and opportunities. I think there are many challenges, for sure. Eduardo also are experiencing a bit of that now, because we've been trying to include more indigenous peoples in things that we've been writing and so on, and they are always very busy with other things because they deal with surviving issues, you know. So like the forest is burning, someone is dying, there are like floods, you know. So it's not like they will have the time to review an article in the time that we need them to review an article or something, you know. So this collaboration is very, very challenging. but at the same time is very rich, you know, and I think more than ever they are willing to collaborate. And there are many of them, they're actually acquiring degrees, you know, are becoming masters in something, or doctors, or so on, and are kind of like, let's say, trying to speak the same language as ours, even in a different way, even in their own ways, you know. So to facilitate these collaborations, I think what we need to do is to, again, to identify the topics and the things that there are intersections and complementarities in terms of our knowledge, Western knowledge, and their knowledge. So dreams, for example, to me is a great intersection, you know, because for them, dreams are actually a source of knowledge, and in a way that they, again, acquire knowledge about plants and about things in their lives and so on. And we've been studying dreams in Western science for many years now, as again, Claudia showed. But there are other intersections as well, and things that needs complementation as well, both for them and for us. So it's up to us actually to work out on how to frame these collaborations with them, of course. But yeah, that will be very helpful in overcoming the challenges as well.
Something.
Yes, yeah.
Is this working? So, you know, I think the role of the humanities in the psychedelic renaissance has a lot to do with how we are dealing with the diversity of knowledges, right? And I think this has come up in a number of different ways. My sense is that the basic tension is between pluralism and cosmopolitanism. Pluralism meaning you kind of preserve and respect and tolerate and work through differences. Cosmopolitanism meaning you engage with other forms of knowledge and you learn from them, you integrate parts, you appropriate elements of them, and so on. So there is a tension between these two poles. And I think, you know, this has come up time and again during today's talks and yesterday's talks. I mean, Eduardo's point about EBM plus, for example, as recognizing alternative forms of evidence would be another area where this kind of bleeds into sort of this area between humanist engagements and medical practices, research practices. But I think there is a third pole that I think is kind of interesting and that might actually become even more relevant next year. Which is this issue of epistemicide, right? As a form of killing off some kinds of knowledge. And I mean, epistemicide is always brought up as sort of an epistemic sin in this kind of discourse. But I was thinking, you know, I spent some time as an anthropologist of knowledge cultures studying neurophilosophy as a knowledge culture, just as an object of research. And Patricia Churchland became infamous for promoting eliminativism, meaning any concept that can't be reduced to a natural scientific concept should just be eliminated from our vocabulary. And okay, so that's pretty much a clear-cut sense of you know, a version of epistemicide. But at the same time, we also have this problem that there are certain kinds of, say, local knowledges that we actually do want to eliminate for good reasons. And I think, you know, when RFK Jr. is going to take over this sort of FDA, NIH, and all these other health-related government institutions, and you have climate skeptics in the White House and all of that, there is a real question about how to distinguish between forms of knowledge that we want to include in a conversation, and forms of knowledge that we want to exclude from these conversations. And diversity is basically, I mean, it's a good epistemic value, but it cannot delimit itself, right? Once you start subscribing to diversity for its own sake, there is no way of excluding anything, basically. So I think, you know, there needs to be a conversation as well about what is a good epistemicide and what is a bad epistemicide in this context.
I mean, I totally disagree. I will just say in 2 sentences why. Who is to decide? And frankly, if people are in such powerful positions, even if it's only one society in the world, and there are many with similar kind of political positions are currently in power, to actually exclude them from the discussion seems the last thing one should want to do. So maybe philosophically speaking, the question is, what is even knowledge? If we take this as a sort of more defined term, then maybe what counts as knowledge is a question that is hidden within this. But certainly to actually have anybody decide on purpose, or, and that is how usually this epistemicide happens, more out of thoughtlessness, not necessarily out of the will to destroy, you know, and make disappear. But I do think it is very difficult to even see oneself in a position to decide this. What do you think about this, Fernanda? One of the researchers actually asked me to ask you, what is in terms of the care for indigenous rights, what should researchers who set out to do research now or undertake research in the psychedelic space now do to be sure that their research designs are respectful regarding indigenous rights? So maybe I can tie this together. What do you think about this question of epistemicide?
Yeah, it's really very difficult to decide in terms of what gets sort of like eliminated or put aside. I get your point in terms of like it can be, you know, dangerous somehow to acknowledge all types of knowledge. But again, as Christine said, you know, we also need so I'm sorry, I don't know what happens when there are like the echo. But yeah, so it's who gets to decide it. It's the point that she puts, and I really agree, and I think that's what I was saying about questioning what is science. Sorry, I don't know what I do, if it's something I do here or you do there that changes, you know. But yeah, just to go to the other question about how to care more in terms of indigenous rights and incorporating this into our work. I think, I mean, very simply put, I say it is basically to listen to them, you know, and it may feel very obvious, but I keep hearing people saying, you know, oh, we need to give the chance for them to speak, we need to raise their voices and so on. And to be honest, I think they're screaming already for many decades, you know, and it's more on us to listen, to be open to what they are requesting in terms of their rights, in terms of you know, how to reparate their history and how to give back what they were like stolen and so on, including their territories to begin with, and with that their culture, their identity, and their medicines and everything, you know. So simply put, I would say it's our ability to hear and to listen to what they are requesting for many years now that needs to really be worked on. So we are able to care more for their rights and their voices and their wishes and so on.
And I mean, in the sense of who need to make up their minds about this, one, I think, is regulatory science people will not be able to circumvent that question because they should have an opinion about what kind of knowledge informs regulatory decisions and what kind of knowledge does not. And ultimately, regulatory agencies like FDA need to think about what kind of evidence they accept. I mean, that's the whole point about the EBM plus discussion, right? That you kind of extend the horizon of what kind of evidence counts and what kind of evidence does not count. And I mean, another group that I think needs to make up its mind about it is normatively oriented epistemologists and philosophers of knowledge, because I mean, I think that, you know, this question of what is a good epistemicide and what is a bad epistemicide is one that needs to be answered in these contexts, because we must exclude some kind of knowledges from this kind of decision making. I mean, we're acting on the basis of knowledge claims, and if we cannot decide what knowledge we consider valid and what knowledge we consider invalid, then we cannot decide, or we will decide in a poor way. So I think this is a discussion that needs to happen in the philosophy of science and knowledge at the end of the day as well.
I mean, Ernesto Rabello in the chat means that it is really very easy, that it's not difficult to decide that fascism, climate negotiationism, and far-right perspectives must be fought and excluded. And whilst I think there might be ways in which they need to be fought, and we need to think how this can happen, I don't mean with weapons, that doesn't necessarily mean they need to be excluded. I actually think that's a mistake, but maybe we disagree on this. And maybe this is not the central question of our panel today, how to deal with the diversities in which the, for people like me who grew up in the sort of postmodern times, these, and very much a Foucauldian, very much into Latour, etc. He wrote at some point that we forgot to make sure that we consider what are the matters of concern. And this question of the matters of concern, how we center on them, and maybe for this panel, this really means coming back to the more psychedelic questions directly. But I think that allows us, to some degree at least, to find criteria for what is and what isn't knowledge that we agree is valuable knowledge, that may be different from knowledge that hasn't many legs to stand on, or is simple ideology. If we can't make some distinctions here, then it's really difficult. As a philosopher, I believe we can. But I would like to go into the psychedelics questions from the chat. We have until 12:30, so we still have 50 minutes time for questions.
I just want to add one thing to this question about knowledge, though, because I think it has direct bearing on psychedelics, as it does to the rest of medicine and psychiatry, which is, you know, psychiatry and medicine both have the power to compel people to undergo treatment that they do not want to undergo. And while there are these sort of currents of, you know, pushing for lived experience and quote unquote consumer involvement, i.e. patients and influencing medical decisions, medicine ultimately has the final authority in most cases, at least in American hospitals, certainly in this state. And this directly relates to psychedelics because you have, you know, multitudes of people out there saying they want to take essentially clinical matters in their own hands. They experience depression, they want to treat themselves or find treatment from someone else underground with psychedelics as a direct psychiatric treatment. And yet the medical authority is saying that that knowledge is not as authoritative as the psychiatric knowledge that says, well, no, show me the evidence. The RCTs don't prove this yet, so you can't do this. So I do think that that is a kind of battleground that is playing out and is embedded in psychedelics and in illegal drug use of other drugs as well, where people have, you know, personal viewpoints towards why they want to use drugs, and yet psychiatry and addiction medicine as an arm of the government enforcement essentially tells people that this is a pathological behavior.
There is a related battleground, Franklin, which is this push on the American right for medical freedom, right? That has been a debate that started in the wake of the COVID medication discussions. And you do have a movement that presumably will be associated with the incoming administration that is invested in giving doctors the freedom to prescribe what they think is right, rather than being bound by regulatory decisions, right? And so far the problem has been that if you prescribe things that are not allowed by FDA regulations.
You need to speak more in your microphone.
If you prescribe things that are not allowed by FDA regulations, then the licensing board could take away your license. But with the medical freedom movement, that would no longer be the case, right? You have the freedom to just prescribe whatever you think should be prescribed. That will probably include psychedelics, or ivermectin, or bleach, or whatever else you want to give your patients. And again, I think, you know, that's going to be a really pressing issue in the next years.
Yes, please.
I apologize. Sorry, Zoom people. I was just saying that Robert F. Kennedy Jr. posted yesterday on X a list of substances that are part of what he called the FDA's war on public health, and psychedelics was first on the list, though ivermectin was also on the list.
Ivermectin-assisted therapy.
Yeah, exactly. There you go. So that's relevant to the comment that I wanted to make. The debate about what the topic is appropriate, because the kind of social theory version of Franklin's talk about projection and psychedelics is that there's no way to talk about psychedelics from a social theory standpoint without also talking about epistemology, without also talking about decolonization, without also talking about power in the medical context, without also talking about politics. All of these things are constantly in play in the debate. So the practical question then for any given conversation just becomes, which ones do we particularly want to focus on? And to me, the biggest takeaway, and it's relevant to this, to Robert Kennedy, is that we actually can't assume a lack of overlap. We can no longer plausibly talk about psychedelics today by saying, well, we're just going to talk about psychedelics in the medicalized paradigm, or we're just going to talk about psychedelics in the indigeneity and decolonization paradigm, or only within the epistemological paradigm. They're all going to be in play constantly, because that's how culture in fact works, and that's the embeddedness that we're in. The striking fact is to look at how all of these different cultures are deploying the idea of psychedelics, the experience of psychedelics, and the discourses, to see how they intersect. That's the intellectually interesting part of it. And then the practical part of it is, if one has a strong view about how one wants the world to go, then the solution then becomes to pick and choose among these discourses to advance a particular program. But there should be a two-step process. First, we should try to figure out what we ought to think. And then we ought to try to enable the thing that we think is best to work in the world in some way. Anyway, that was just a thought that I wanted to have.
Okay. There was another hand raising, Joshua after, but first Tristan. Tristan, okay, wow.
I thank you for the very stimulating talks and discussions. I'm Ashwin Budden. I'm a research fellow at the Center for Bioethics at the Med School. I'm also a medical anthropologist working in public health, global health. Maybe just picking up a bit on the last comment, I think one of the kind of imaginaries, if I can kind of drawback on that term that probably has not sort of risen to the surface so much in this discussion is around the role of psychedelics in enhancement as an enhancement technology. So it sort of perhaps sits somewhere in the Venn diagram between therapeutics and sacralization. In kind of thinking about the explosion of enhanced, both discursive as well as an industry around enhancement, whether that be genetic enhancement or other forms of neurotechnological enhancement. I'm wondering if you could comment a bit on where you see sort of this kind of expanding how we think about psychedelics within this sort of emerging space as well.
Yeah, thanks for bringing up this topic. It's been floating around in different areas, as you rightly point out, and yeah, it has a lot of bioethical dimensions to it for sure. And I see it as popping up in the different imaginaries I described. Maybe not so much in the biomedical, of course, because there you are by definition a patient, and so that's what we usually say, we are restoring a state, a healthy state, or that is kind of lost, right? But if you are in the enhancement discourse, it's more about you are in a good state and you just want to get even better, right? Performance enhancement or whatever word you want to use for this boosting of something that's already considered to be quite okay, or at least not in need of any emergency treatment. So of course it's in that discourse and framework, it's about elevating certain positions in society that are already kind of more privileged than the ones who are affected by the different isms, injustices that I also projected. So yeah, there is an ethical issue in there as well. So yeah, I think that's also, of course, continuing in the whole discussion and with elites using psychedelics, and they have always been using psychedelics. We had the same discussion in the 60s where you also had the different camps. Is this something for elites? Is it something that needs to be democratized? So we continue to see this also in the psychedelic revival. And certain imaginaries, of course, will be enabling a ground also from which enhancement will be possible more, right? So legalization for sure, and decriminalization certainly as well. In the sacramental imaginary, you could also argue that becoming more spiritual is actually also an enhancement. Isn't that the ultimate enhancement of the human species, that we are evolving into I like this term of moral enhancement that has been brought up by psychedelic bioethicists as an alternative to the more typical form of enhancement that we think about. So to think more along this line of what can moral enhancement with psychedelic look like also in the framing of the different imaginaries is something I would definitely encourage us all to do.
Oh, yeah, there is no evidence that there is either cognitive or moral enhancement through psychedelics. There is absolutely no evidence for it.
I'm not saying that there is evidence or that, yeah, this is a fact. I'm saying this is an interesting framing we should consider as a concept to think with.
I just, I guess my sense is just that the enhancement debates, and I think that was already the case with the cognitive enhancement debates, are kind of sort of bioethics fictions. It's what if there was a drug that would enhance you morally or cognitively, what would that mean? But if you look at the actually existing drugs, I mean, the cognitive and so-called cognitive enhancing drugs are so full of trade-offs that they enhance one capacity at the expense of another capacity. And I think it's the same thing with the supposed moral enhancement. You ultimately it's just not the case that people who are taking psychedelics would become more moral.
I totally agree with that assessment. And when I'm speaking of moral enhancement in the psychedelic context, I always mean that, well, as I also said in my presentation, we need to have a bigger understanding and also consider group dynamics and the relational dimensions that are actually, for me, what morality should be about, and not so much something that's in your cognitive interior, but rather how we, again, as a society, as cultures, engage with each other and treat each other. So maybe psychedelics can play a role in certain settings to enhance the moral infrastructure of a certain culture. And but of course, that's not, psychedelics don't play an exceptional role there. They can be part of it, but they don't have to.
I would like to make a short comment myself, because I would warn against using the enhancement language, even if we want to talk about things getting better. But this question is really, even if there were people who felt that they themselves and the way they see the world has become more moral, in a moral sense better, going through psychedelic experiences in communities of whether they are religious or therapeutic or subcultural, or the ecodelics papers talking about environmental connectedness. When we use the enhancement language, it is, I think, historically quite directly related to the eugenics language, and it is always about having institutions who actually come up with techniques that would make the populace better. This is not where I would want to see this situated. So if we want to talk about people changing in ways that they feel they are better people, then maybe that might not be the psychedelics, but the community. That's a different question. But it might definitely not be helpful to use that enhancement language in order to capture it. But there are other people wanting to speak.
Yeah,
So Kristen first.
I do want to add one other perspective to the question of enhancement, which is really that at least in the United States regulatory structure, I think it's pretty moot, because if you're talking about something that is framed as a drug, i.e. a material object, because we have a materialist bias here. If you have a practice that makes you better or makes you feel better or whatever, the government's not going to regulate it. You can do whatever you want as long as you're not putting something in your mouth or your veins that's defined as doing something to your body. Once you do that, the government steps in and gets to control whether or not you're allowed to do that. If psychedelics or anything were found to enhance something, it's almost 100% unlikely that the FDA would ever approve something like that, because the FDA approves drugs that you are allowed to use for treating negative things to make them better, not taking something at a neutral baseline and making it more positive. So even if they did enhance things, you're still going to be coming up against the legal structure of what is the justification on a regulatory end.
We have 3 questions in the audience, so.
I just want to briefly go on the record to call out the inaccuracy of describing the incoming party's agenda regarding medical freedoms, considering their policies on reproductive rights. That's all.
We have one more here.
Good afternoon. Do you think some of the considerations that we've talked about here are hung up? I just had a brain fart. I'm sorry. About a bigger systemic picture of our healthcare system in general, where we don't address the whole health of the individual. And the basis of psychiatry would be to address some of the inner trauma that somebody's had, and see how it affects their everyday life, and go from there as a healing process. I think a lot of these processes that we go through in everyday health are to address a direct issue as opposed to the overall issue. And maybe the system itself could use some psychedelics to gain a little perspective overall how these things affect each other. it's not just a individual problem, it's a broader picture.
Yes. I agree. I think, you know, and this is what I was speaking to and what Noah, you were talking about, is that, you know, psychedelics kind of are this like flashlight, or sort of like this little cord that you pull and all of this other stuff comes out. You can sort of shine the flashlight in all these different directions, including kind of within the medical framework. It's sort of how we conceptualize the dichotomy between illness and wellness, and what is treatment versus what is just a practice for feeling better, enhancement versus improving pathology. All of these questions are revealed when we sort of shine the psychedelic flashlight at them.
I'm David Anik. I've been really enjoying all the panelists and all the questions. So thank you very much for all the care and thought you've put into your comments. I'll identify myself as both an MGH psychiatrist and somebody who has spent time among Native communities and just trying to just take in a decolonization experience of another way of being in community. And I'm not sure I've put my thoughts all together that well, but they kind of center around the whole concept of community. So I know some places in some indigenous groups, and Fernanda, you can sort of comment on this, or any of you can, there's a concept of soul loss as the kind of the definition or the terminology of what's wrong with somebody. And I wonder if part of the paradox here could be resolved by shifting, you know, what we define as mental illness or how we conceptualize it in the first place. And then the ceremonies, which may include ibogaine or other psychedelics, are about reintegrating that person into community. And that's how they see, you know, the person they will benefit and the community will benefit, and, you know, whatever is the intended baseline can be restored. So that's maybe one part of this. And I appreciate like Claudia's experience of like, you change your community and everything else changed. You know, it wasn't a drug, it wasn't a treatment, it wasn't a diagnosis, you know, it was a complete, and yet, you know, I think that's like an experience that really could be held up as like, is this something many more of us need? So, you know, I think often is the question, is what we call mental illness really an alienation from the society, and that a whole different, you know, how do you be sane in an insane world? Like, how do you be healthy? And when we don't have community, when we don't have care and safety as our baseline in our everyday life. So, you know, it's sort of, we can try to help the person feel their symptoms less, but are we, you know, there's a whole different concept of cure about, and wellness about that. So I'll just maybe just say, I don't know about morality, you know, being enhanced. That's maybe something that's we're used to defining from the outside according to, you know, rules. But if these things are being called, or some of them being called empathogens, certainly empathy would be, if you want to use the word enhance, or extended, or somebody could be more capable of that. I would think that can only help society to have more glue and more coherence, which would be good for both the individual and the community. So I'm not sure that, you know, I haven't measured it, you know, but if it seems to me that empathy is one of the things that's really been thinned out in the world that we're in this Western world. So I'm not sure that if psychedelics really go that direction, that we wouldn't be able to say that they help them. Now, I would agree with doing it in a context that where the context, the set and setting also reinforce community building and safety. But there's probably a role for the psychedelics in that. So I'll stop.
Fernanda, would you want to come in?
Yes, thank you. So in terms of like this concept of soul loss and how you were saying like the differences of illness for different communities and so on. So I always think that, for example, in our society, in our modern way of seeing things, like if a child has some sort of like visions or ways of communicating with other beings, and maybe come to the parent saying, oh, and oh, and and come to his or her parents saying that, I'm communicating with spirit. I think I saw my grandfather or something like that. Like, the parents in our society will immediately think that the child is sick or has some sort of like psychosis, and then it's gonna take him to a psychotherapist and to medicate the person, And in a traditional community, if that happens, actually, that child goes directly to the page, to the shaman, to the healer, to be actually trained as a shaman, because it's a sign that he or she, has an open channel to this other sort of like world, this spiritual world, this other types of languages that normally we shut ourselves from in our society. And if someone is a bit different in that sense, is sick, and it may be sick. I'm not saying that that there is not the case, but I think we do sort of like restrict this understanding a lot in our society. And in terms of like the loss of the soul when you are into the effect of psychedelics. To be honest, I mean, I think, again, this may be a Western concept as well, because like when the indigenous talk, the indigenous that I work with, so I don't want to generalize here, but like when I talk about this with my teachers and so on, like what they say is that normally your soul is gonna leave your body, and especially in the effect of these medicines. The difference is that we again, being the new kids on the block here in terms of using these medicines, we don't know how to deal with it. So we normally don't know how to make our soul come back to our body in a healthy way, So for them, it's almost like your soul is gonna need to come out of your body to reach out to different realms of reality and to know about other things and other beings and of your past or of your ancestors in a broad way, not just your family ancestors, but like the other beings that inhabited the land that you were living in and so on. So you need to do this sort of like soul trips to understand better your reality, but the way they do it, it's much more experienced than the way we do that. And so that's why it becomes a bit of a problem for us, and it can make ourselves to be lost somehow after like a trip like this, So yeah, I think that's my main comment. I think about community, I've already said some words before, so. We cannot listen.
Empathy amounts to moral enhancement. Is that I think empathy is a moral emotion, but it operates as part of in a larger mix, right? And one book that has shaped my thinking about empathy a lot is Fritz Breithaupt's The Dark Side of Empathy, where he basically argues that empathy, the primal scene of empathy is not me encountering somebody and feeling empathy with that person, but it's me witnessing a conflict between two other parties, and I identify one as the underdog, one is sort of the oppressor, the other is the oppressed, and I tend to empathize with the underdog in that situation, with the one who's been attacked or who's kind of the victim of something. And oftentimes, if you think about this in terms of political conflicts, it's often not clear, what exactly the situation here is. It is often a question of, what kind of narrative do you have about who started the conflict, who attacked whom first, who just retaliated, and all of that. And empathy creates an identification with one party at the expense of the other party. So it has a tendency to fuel polarization, to take sides in a conflict, and so on. And I mean, I don't think that, of course, empathy is an important moral emotion, and I think it's in some sense, it is an important part of a larger mix. But this idea that, you just amp up empathy to the max and then you're a better person, I think that is too narrow a view of the role that empathy plays in our kind of moral psychology.
Thank you. Claudia?
Yeah, I want to connect still with that because I think I don't want to defend the MAPS paradigm or any of that sort, but I think it's important to go back to what MDMA therapy can offer, especially for survivors with extreme trauma and who often also suffer from internalized shame and guilt. So its empathy is also something you can or need to develop for yourself. If you have gone through these experiences, you kind of cannot have the empathy with yourself and with your previous selves, considering that the self is something that's not so fixed, perhaps. So yeah, in the healing process is also having this empathy for you in that situation back then, for not being able to cope better, in addition to having empathy with the perpetrators and also being able to understand why things happened the way they did. And so at least that in this particular situation that you experienced, you can get rid of the impact of the trauma in your life, and that then changes something. And that's of course a bit different to the bigger politics. I think you're right about describing the difficulty of empathy in this sphere. I just wanted to add this additional dimension that actually MDMA therapy and MDMA or other psychedelic substances could just enhance these empathy enhancing processes in our societies.
So I have quite a few online questions. If you allow me, I would bring them in. So one is from Vladislav, asking about mental health issues and access to legally assisted therapy relating to the underground. I think we have addressed aspects of this already. So I tie this in with some other questions to just let you know what is there. So one is about, one is that actually the numbers that you presented, Nicholas, have been sort of deemed outdated. There are now 300 plus licensed therapists in Switzerland who are authorized to work with psychedelics, and more than 3,000 patients that went through psychedelic assisted therapies in this way. There's also a link to a manual. And I think that links, and then another question is about the relationship between the spiritual that Franklin had brought up and that Niklas had brought up in a different way, Fernanda had brought up. So I think that several questions relate to this way in which the spiritual is sort of a different route that might be implicit in other routes, or whether this sits in the psychedelic experiences and what you understand psychedelics do, and where the institutions come in and are at play between medicalization on the one hand and spirituality on the other, or religions, or also organized.
Is Fernanda going to talk now? Christine?
Fernanda.
Christine? Is Fernanda going to answer now? Or
are you?
Well, I could. I'm not sure if it was directed to me, but I could give some insights. Okay. Just a second. Or maybe someone can do that just for me, just a second.
By any means, but I brought it into the conversation to highlight the fact that psychedelics, like other practices historically and contemporarily, occur in a larger context, and sometimes that's a spiritual context. I personally think that probably the single biggest risk that psychedelics pose to people are that people are now finding their way to psychedelics without any sort of interpretive framework about what they do other than 5-HT2A receptor agonist activity. And I don't think that that is a sufficient container to support and protect people. And I think we're going to see a lot more of that. So what is certainly very clear is that, where most people use psychedelics, whether it's in traditions that are thousands of years old or traditions that arose only a few decades ago, that there tend to be customs and even rituals and frameworks that surround them, as well as communities and kind of a social vessel that supports and I think in many ways protects people. The issue in modern medicine is that we decontextualize these things. We strip them of all of their contexts, and that is how we turn them into an object of scientific inquiry, and that is exactly what, as Eduardo was talking about yesterday, the randomized control trial does. It isolates the idea of a psychedelic intervention as being this time-limited material object thing that the patient takes, and you look at the results. You don't include the overall context. So that was why I brought up the spiritual kind of paradigm as just one of many paradigms in which there's an interpretive framework that I think probably does, on average, a better job of holding and supporting people who get exposed to psychedelics than we are currently offering in medicine.
I think another perspective would be to think about spaces for psychedelics beyond both medicine and religion, right? And for me, one inspiration in that context is the work of Pierre Hadot, who was a historian of ancient philosophy, who argued that ancient philosophy was not about theorizing, but it was a way of life that was based on spiritual exercises, right? Like the Stoics sort of working on themselves to become to adopt a Stoic posture towards life and so on. And I mean, I think that's kind of an interesting question, right? How you can reanimate a conception of philosophy as a way of life that includes spiritual exercises in a sort of late modern context. And we had a conversation yesterday over lunch about the fact that Aldous Huxley ended The Doors of Perception with a plea for nonverbal humanities. And I asked, since Franklin and others here had done this holotropic breathwork workshop before this conference, whether they see a potential for including that in, say, a philosophy college class, right? And I think there are really interesting questions around the ethics of including these kinds of spiritual exercises in these sort of academic pedagogic contexts, which sort of move you slowly from including holotropic breathwork to including psychedelic experiences and so on. And we had a lot of interesting disagreement over whether or not there should be kind of red lines in classrooms around these things or not. So I think, but I do think that this question of nonverbal humanities and spiritual exercises is one that really is interesting if you want to think about philosophy as something that is not just theory.
Just to do a response to that, and my opinion at this time is that the introduction of these sorts of things in a pedagogic environment introduces a risk, because there's essentially dual relationships, which in medicine you have to be very careful about. You can't treat somebody as a patient and be their friend, as one example, or be their educator and giving a medical treatment. We also discussed that perhaps a more ideal world would be one in which there was a way that this could be done, but that the world of right now, that there are these dynamics, and we do not have what I believe to be a sufficient container to protect against the conflict of these two dynamics. The other thing that I wanted to mention that's been on my mind all morning, and in regards to your comment, is a paper by a Dutch author, Peter Stockinck, in a book called The Psychedelic Policy Quagmire. And the chapter is called Psychedelics as a Practice of Truth. And Stockinck does this master integrative synthesis of some of Foucault's writings in the early 1980s before his death, alongside a lot of sort of the questions that we've already discussed with epistemology and different ways of accessing knowledge, starting in ancient Greece, where eudaimonia and the idea of philosophy was really more of something that was applied that would allow human beings to live the quote unquote good life and live a life of fulfillment and flourishing. Whereas in the Christian era, this could have got turned into knowledge simply being something that you read in the Bible, do good works, and then you go to heaven. And I think we're sort of still in that form. But what Stockinck talks about is this idea of parrhesia, which Foucault was very interested in. It was this component of Greek philosophy that was aimed at being able to discern what the actual truth of anything was, and to be able to speak what the truth was, particularly speak the truth in the face of power. And so Stockinck advocates for the idea that psychedelics, in the form of an applied practice, could allow this, what he calls psychedelic parrhesia, being able to sort of discern deeper truths and to speak them and affect change in society. It's quite a paper, and I recommend it, but it has a lot of bearing on this conversation, so I tuck it in.
I would like to do, we have 10 minutes left, and I would like to do two things. One is ask in the room here, who of you has more questions? Matt? But for now, I'd like to keep the answers short. I have a last question, and then I would like to give the word first to Fernanda before maybe people.
Picking up on some of this discussion, I'm thinking about the window of learning research and this idea of psychedelics as a potential tool for self-education, sort of somewhere psycho-spiritual, rather than enhancement, but for deepening one's personal gnosis and improving one's way of being.
Okay, I mean, this sort of may link well with the other question on spirituality. Fernanda is still waiting to answer. Would you be okay if I give the word to her first now, and then the other participants? Or were you speaking to somebody directly?
No.
Okay, thank you.
Thank you, Christine, and sorry for my kids' interruption. Yeah, so in terms of the spiritual question, I think, again, it goes back to the experience. I think these things are much more experienced than explained. So it's very difficult to use like the mindset that we have as scientists. There is even in social sciences, even in philosophy and so on, still is very rational. Still, we want to define everything. We want to understand everything. And then again, for the indigenous people I work with, we think too much. You know, we need to be more sort of like open to the experiences, and then that doesn't mean like something that it's alone in one situation, but something that will actually unfold in different ways, because in the case of their medicines, when they have this experience, the experience will actually last for many days after. And so it's not just what you experience in terms of the spiritual connections that you get in that amount of hours that you are under that medicine, that it's the most important thing. Many times it's actually what comes after in their knowledge. And what comes again in your dreams, which animals are going to cross your path, because all of this has a different meaning to them, and so on. So I also remember when I was talking to my Yawanauer teacher, when I asked how do they say sacred in their language, in their native language, and he said that there is not like a one word to say it, but it's actually it's represented by the act of breastfeeding, because feeding the baby, it's like what keeps the baby alive. And I couldn't like contain myself to be questioning, to be thinking like, how are we feeding ourselves, you know, not just with what is sacred to each of us, and it's going to be different. It may be breathing exercise and meditation, or it may be a religion, or nothing, or whatever. But how, as Christine was saying yesterday, you know, how we are feeding ourselves in different senses in our modern culture and societies. I think there are many distractions. There are many things that are being offered to us all the time to feed our emotional feelings, to feed our bodies, our spirits, and so on. That is actually very different than it used to be in the past. We don't need to go far into indigenous groups, or you know, or hunter and gatherers, or so on. You know, if we go back to some years ago, we would be feeding ourselves with different things, both again in a like physical way, emotional way, spiritual way, and so on.
The last question I would like to ask every panel speaker is, and maybe Fernanda, you start answering it first for technical difficulties, is what is the research that you, if you were to start out now researching this field, what is it you think should be the focus? What research do you think is most important or most exciting to do from your position within that field and with respect to the medical humanities more widely?
Well, I think in my case, thinking about ayahuasca and what I presented here, for me as an anthropologist, I would like to see again the intersections, like, and dreams are something that for me would be very interesting to understand more about. But I also think, like, when we think about all the brain research that is happening around ayahuasca effects in the brain, I would love to see more about their effects on the gut, you know, and how to study that, and how to understand more about our gut reactions, which is actually how, again, many of these indigenous people live their lives. You know, if they are afraid of going in some direction in the forest when they are hunting, they are not going to go there. They are going to, so it's much more in a gut feeling, intuitional way that they decide their daily lives than in the rational thought, you know. So I would love to understand more about that as well.
Talk. Could I ask the other panel speakers maybe answer this last question or give any last statements?
Sure. So, I mean, I would want to offer an alternative to this idea of moral enhancement, which is, so what I don't like about the enhancement concept is that enhancement assumes kind of a one-dimensional increase of some capacity from being less moral to being more moral. And I don't think that that's how human morality works. There's like sort of a wide variety of competing ethical projects. And I do think that psychedelics have psychopharmacological effects which are morally relevant because they affect moral cognition, moral affects. We've already talked about empathy, but intensification of experiences of meaning are another dimension to that. Increased suggestibility is a component of that, the sense that people discover some sort of authenticity. I mean, all of this is morally relevant. And I think one key area for the psychedelic humanities to do more research on is to study how these psychopharmacological effects are taken up in competing moral and also political projects. But I don't think that that is a form of moral enhancement. I think, you know, I mean, if you look at how psychedelics are being used by groups on the right or far right, they get something out of these experiences just as participant in a Shipibo ayahuasca ceremony does, or somebody going to a Grateful Dead concert, right?
Thank you. Claudia?
Yeah, I would like to see also connecting with Fernanda's vision and dream. I already phrased my dream at the end of my talk, but building on everything else, I think, yeah, whatever research brings us more into the here and now and into our fully embodied conscious state as yeah, human beings that then can make these decisions. I fully agree that need to be more from the gut or from the intuitive level, and yeah, to not just rely on the rational. So anything that gets us more into that direction is something I welcome, and I'm happy to contribute. Yeah.
When Johns Hopkins published their first psilocybin study back in 2006, Houston Smith, who was the scholar of world religions and also one of the participants in the Good Friday experiment in the early 1960s here in Boston, was interviewed on the results because the psilocybin study was a study of people who had a spiritual practice. And he said that in the end, it's really altered traits, not altered states that matter. And that history shows that without a social vessel to hold the wine of revelation, insights from extraordinary states tend to dribble away. And I think we're really missing the social vessel to hold whatever the wine of revelation from these psychedelic experiences is. And from clinical trials to the way that we practice medicine and science, the isolation of the individual is being replicated in so many different ways. And I think we're ignoring the community component, which on a broader level makes me think of this, what Fernanda, you said about feeding. And I would suggest that really, I imagine that the concept of the sacred in feeding is really not so much feeding, it's nourishing. And that's the difference between hedonia versus eudaimonia. And so how can we allow these insights of psychedelics to be more focused on nourishing both ourselves individually and at a community level, as opposed to simply feeding, which is more of a state hunger solution? So my hope is that I think psychedelics do offer some promise and potentially allowing sort of the system to maybe gain some insights. Somebody had a comment about that. And you know, maybe we should be spending a little more time on letting the system adapt to psychedelics rather than hacking and slicing and dicing psychedelics to conform to a system that is woefully inadequate in so many ways. So that's my hope and vision over time.
Thank you so much. I herewith we've closed the discussion. We will be around here for a few more minutes while we are setting up. Yeah.
Eduardo, we also want to hear your. Why don't you join us and become more visible?
You got the mic, Eduardo. Let's hear from you.
Oh, I think I just want to thank everybody for the. Is this on? Yeah. So I want to really thank everybody who came, everybody who helped organize this, the Mahindra Humanity Center. TBL is here. Thanks for taking the time to be with us these 2 days. It was wonderful. I think we are really doing something of significance here. Many important ideas were brought up. A few disagreements, which is good. Without disagreement, we don't really advance our ideas. We just stay locked in our own thing. It's definitely a complicated topic. Psychedelics right now is not an easy conversation to have. In July, I was here as one of the speakers of the Petri Flom Center, the Psychedelics Bootcamp, a 3-day event, and in the end, they invited whoever wanted to say some very brief words, and mine were like, things are very messy right now in this field. So psychedelics pertain to legal discussions, to religious spirituality discussions, to medical discussions, to social justice discussions, to decolonization discussions. It's huge. It's really, really big. And I like very much the framework of the social imaginaries, because they help us think, help us understand this broader, messy situation. So I think, for me at least, this event was really helpful in hearing other positions, perspectives, to think more and to realize that there's still so much work to do. And we are happy to think about next steps so that we can continue doing this work together.
That was such a nice note to end on. I don't really want to say anything more. I think other than the fact that I think as an anthropologist, like I said yesterday, I'm less prescriptive and more diagnostic or critical. And I think for me, what is most interesting about right now is really tracking what the new attempt to create legal structures that don't exist within medicalization that are being experimented with, what those are going to look like. And to think about the ways in which they employ different epistemologies and different ethical frameworks. Because for me, I still come to these questions out of the questions of criminalization of substances, and still thinking about what are the alternative ways we can approach these substances, which are not either medicine or criminal substance, right? So that's not as eloquent as Fernando, but that's.
Before I do another thank you round, which may not be long, this question of research, I really do think we have touched on a lot of the aspects of the ways in which psychedelics connect, the field is confused, everything comes into it, like with so many other things. But on the other hand, there is this quality of a type of experience for which our languages don't provide us with words, and which our cultures have for hundreds of years tried to exclude and marginalize or put into the frame of the psychiatric case, rather than a sort of legitimate way of experiencing world. And the humanities are probably the only space in which other forms of expression through language and poetry, but also in the arts and in films and in maybe smells and in the technologies of perception that actually psychedelics might open the door for, as Marcuse put in much more eloquent words some 50 years ago, is where the humanities can form a bridge and maybe help give a different form of validity to these marginalized experiences, through which so many who are part of the psychedelics discourse think their lives are enriched in ways in which our modern culture tries to sort of deprive them. So I think that connects to the nourishing and the feeding, but it also says something about the ways in which humanities do have an important role of bridging between the very binary stigmatizing discourse that operates in medicine and that operates in the space of religion too, but that the in-between people, that is most of the people in the psychedelics community, actually have and are working towards other ways already of expressing themselves with embodied consciousness. So that was my final words on where the research should go. Thank you so much for being here. Thank you for joining us online. Thank you for your many questions. The ones that I couldn't bring to the speakers, I will send them in the chat and they can respond to you. I thank everybody who enabled this event, who made it possible for us to be here and have this discussion. Thank you so much to the funders and the Mahindra Center, to the people in the CSWR who supported us with putting it on, and also, of course, to everybody who actually took the time and come and wrote a talk and is actually making all the effort to being here and who comes and listens to us, because without you, we would just be such a sad little pile of few people rambling on. Thank you so much.
Thank you.